Hello, guys. Good afternoon, good evening, good morning, depending on where you're watching from. It's really been a while, and I'm glad to be back. This is the Pink October month, the month of breast cancer awareness. I will be talking about some risk factors of breast cancer, and I'll be dwelling on one. There are a lot of risk factors to breast cancer. Before I go further, I'm Dr. Chuks Precious Anyogu. Here for you guys. So, the risk factors are many, but I'll just list some few. One, the fact that the person is a woman, gender is a risk factor to breast cancer. Age, advanced ages, the more advanced, the more the risk. Secondly, early menarche, that is early commencement of menses, or late delayed menopause, also puts a woman at risk. That means she has a longer, you know, reproductive age time. Then family history. Yes, the fact that a mother to the person, to the woman, a sister, a daughter to the woman has had breast cancer increases the risk. But there's one part that I want to dwell on: the reproductive cycle, or the reproductive history of a woman. It counts, it matters a lot. How many children has she had, and how long did she breastfeed those children? Now, of course, for you to breastfeed a child, of course, you have to have a child, right? So, breastfeeding, I did not say sucking of breast because there are many people saying, you want to suck breast to reduce breast cancer. I don't know where those research were done. All I know is breastfeeding, especially the one that has to do with breastfeeding a child, you bringing out milk to feed the child, it reduces the risk of breast cancer. So, the longer a woman breastfeeds her baby, the lower the risk of what getting breast cancer. Anytime past, it used to be breastfeed your baby for 2 years, and it was achievable because most women were not in the working class type. But now, yes, due to the social economical shifts in our society now, most women are so engaged in work and they can't really afford to do the 2 years. But please try doing 1 year, 6 months. That is 18 months breastfeeding. It is very, very effective too, and helps. It is very effective to the mother. It helps to reduce the risk of breast cancer, and it also helps the baby too for a lot of things. So please. Then also, you see that exclusive breastfeeding, that's the first 6 months of delivery that some women run away these days. I cannot be breastfeeding on demand. And before you know it, you just deliver a baby and start giving and start giving baby formulas. It's not, you're not helping yourself as a woman. So please, breastfeeding is important. If you can breastfeed up to 1 year, 6 months, do it. I understand some people candidly cannot because of the work pressure, the work demands. It's okay. I understand that part. But if you can, why not? 1 year, 6 months is a very good time. Like I said, it reduces your risk of having what? Breast cancer. Lastly, your husband, your spouse should always have time to examine your breast. It is part of their duty. It's not just for them to, for people to always have just pleasure. No. Examine your breast. Even before, for men that are watching this, take your time once in a while. While, you know, touch your wife's this thing, examine it and be sure if there's any lump, let her know. Women too, on a daily basis, as you go to take your bath in the morning and in the evening, just examine. I'm not saying you should start doing some things to yourself, but just examine the breast. If you notice any lump, draw the attention of your spouse. If he confirms it, then you go to the hospital to know why there's a lump there. The earlier, the better. See you next time. Share and let others know about this. Thank you. I love you. Bye.